Hey Justin.
Hello, let me share my screen. Can everyone hear us okay? No technical issues? Thumbs up.
Awesome. So we're just going to give everyone a few minutes before we kick it off. And if anyone has questions, feel free to drop them in the Q&A section of the Zoom bar on the bottom, and we'll be make sure to try to choose a few to answer if you have time at the end. I'm seeing people trickle in. It's going to be a fun hour with all things patient intake today, Justin.
Super exciting. I'm excited for everybody. And thankfully, you don't have to listen to me ramble on. We've got Humair to help me.
Oh, but I want to listen to you ramble on. So let's give everybody another minute before we get started. I see people still trickling in. Hope everyone's having a great Thursday. It's almost the weekend. Arlene, we can see your message, but due to the webinar setup, it's just going to be Justin and myself who can speak during this session. I think it's a Zoom configuration, but I'm sure there's someone on chat that can help. I
Hey,
think we're ready to kick it off, Justin.
awesome.
So welcome everyone to our webinar on registration, patient prep, and payments with Luma. I'm Homer Bernie. I lead the product team here at Luma. And I have with me today Justin, who's our senior product manager who covers all of our readiness products. Justin, a few words.
I'm Justin Mitchell. Like Humair said, lead the readiness products. We'll talk more of what we mean when we say readiness over the course of today, but super excited to have you all here, share what we've been doing, what we've got planned, and give you some insights on the vision for readiness.
So let's maybe kick it off with just setting the big picture here. If you think about kind of the way patient access and patient engagement has really changed over Luma's own history, we've seen a lot of different phases of how technology adoption or patient expectations have changed. And if you actually consider, the digital front door as a concept, we're seeing that there's a lot more of an ask coming through from both the patient side and the staff side to be able to kind of make sure appointment prep is being done in an efficient and timely manner before the appointment time. Now, this can be because there's a lot of problems that are stemming from this. There's still a lot of manual process and outbound calls required to actually get this information from patients if not being done through any type of digital means. So you could be calling to get insurance verification from a patient about to come through who may not have been able to submit that. It could be simply following up on all the different pieces that it takes to actually make sure a patient's ready for an appointment with a provider. And then there's also just a manual processes on the staff side. So whether that be paper forms still being used and having to be transcribed, or whether that be actually putting data into the EHRs manually. Now, what that leads to really is bad throughput, right? That's manual work for staff to have to be done that leads to long in-office wait times. It's just more effort to make sure you collect the information and also the balance and copay requirements that need to be done before an appointment. And that just leads to inefficiencies in your throughput as your patients come through your front door. And we really want to make sure that we're meeting patients where they want to be met. So Class, which is a leading consumer research firm, has actually highlighted that registration and check-in for an appointment is actually one of the primary concerns for patients as they actually think about their healthcare providers and where they choose to actually get their care from. So it seems to be an all-around problem, Justin. And I'm really interested to kind of see, like how does appointment prep bridge the gap between being able to schedule patients and actually the point of care?
Yeah, so Mary, you laid the stage perfectly for us. Today, we're going to focus a lot on the different things that we've been doing to help with appointment prep. Dr. Jogi, you can see in the quote here, he's talked about how important it has been for him and his staff to get patients thinking about the stuff that they want to talk about before they come in. So he in the quote he talks about he's an educator first. What they're doing is they're sending that information beforehand, and it's led to better conversations at the time of the appointments. Patients are ready to go. Again, going back to that readiness mantra that we think about and why I'm in charge of readiness. So we've got here a great example of kind of a screenshot, and we'll have more throughout the webinar. But we talk a lot about readiness, and we think of it as that registration and appointment prep. There's really what we call 5 pillars of readiness, and you can see them on the right-hand side here: patient demographics, clinical intake, consent and legal forms, insurance, and payments. And what that means is that once we get all of those details resolved, coming in and checking in when you're a patient can be a really smooth process. And we'll continue to highlight that throughout the rest of the webinar. But I wanted to make sure we laid that groundwork of like, why readiness? Why does it matter? Why should we care? And as we've spent a lot of time thinking about this, I've worked with our designers and our engineers to really think about it across 3 different layers. One is the patients. We want patients to have a great experience as a patient success platform. We view this as a great opportunity to help patients have an easier process for getting the care they need. Also making sure that they've got the things done that they need to in advance. If there's information that they need to get, we can send that to them via the messaging or the checklists. Those are the great ways to do all these different things. And then on the staff side, this can also make it easier because you've got visibility into where patients are at as they're going through the prep, less manual follow-up. I've heard lots of stories of people spending so much time on prep that 90 out of 100 of the patients that come in, they have to manually call. And, that's just not a super scalable system. It causes a lot of headache for staff and allows for errors to happen when you're thinking about the manual entry, copy and pasting, whatever else. If there's paper to scanning it in, by bringing it all into a readiness platform like Luma, we can actually help make sure that things are pushed in the right spots. And do that as well. And then thinking about it from a system standpoint, that can also lead to those efficiencies that you're looking for with shorter wait times, being able to collect more time of service payments, but even starting to collect payments before somebody walks in the door so that you've got that copay collected before they even walk in, and all they have to do is come in, say, yeah, I'm here, and then sit down and they're ready to go, having that better experience all around. And so great example is we've been working on payments over the last month or two with one of our customers, Ortho Nebraska. And over the last month, as we've been working to increase that collection before somebody shows up, we've been able to improve that by 30%. So what that means is 30% of the patients before they even walk in the door are able to pay in advance, which has reduced that bottleneck of the check-in lines, which is a great thing. It means staff can get patients in faster. Patients have a better experience when they're walking in the door.
Justin, before we dig into how it works, I'm curious, we saw kind of like the 5 discrete areas where you can actually both as a staff or a patient be able to see what is required by a patient before an appointment. Is that in your experience, in your observation, kind of the most concrete structure that you've seen healthcare providers follow? Or is there an ability to kind of change that around or only
I
need 2 or
mean, yeah, great question. So I think those 5, what I call pillars, are the ones that I see as the most common, but there's a lot of configurability here. Some things might fall under that, like if you've got a HIPAA form, that makes sense to fall into the consent and legal area. But if you've got, a pre-appointment education uh, video that you want to share and include in a checklist for a certain appointment type, that might not fall. You could kind of consider it clinical intake, but you could also say, this is just general educational information. And so there's a lot of flexibility here to support what makes the most sense for you and your staff, for you and your patients. Every specialty's got nuance. And so I think the flexibility is what's powerful here. Is what do you need based off of appointments? And we can talk more about the details there.
Yeah, I know it's really interesting for me as a patient. It was always helpful to know how much I have left of paperwork to do. So I like the fact that you have that check post of like how much more is left. But yeah, I would love to actually now dig into how it works and actually give you a chance to show us the Luma solution.
Yeah, let's do it. So again, going back to our ultimate goal, we want a checklist to exist so that patients and staff feel like everything is done and ready to go before a patient walks in, or as needed when the patient walks in, making it easier to complete that, to not have to do it on manual paper forms. So there's a lot of what I'm going to show here as I think about this is Sophia prepping for her upcoming appointment. She's got 3 checklist items and really simple checklist. She's going through her consent forms. She can submit any information that she needs to. It's not shown on this video, but we can also submit insurance cards. And you can also collect payments with mobile wallets like Apple Pay, Google Pay, whatever else. And this is all, Sophia's able to do this while she's sitting at her home table, getting ready, drinking coffee, getting ready for the day, whatever else, whenever it's convenient. If she's waiting for coffee in line, doing whatever else, this is the beauty of being able to send this out, send this checklist, and patients can complete it when it's convenient for them.
Oh, I saw that there was like a save for future transaction. Does that mean if I'm coming back to see the same provider, the same facility, I don't have to retype my card because I hate doing that.
Yeah. That is definitely available. And in the video that I created, I did not actually click that, but you can save it for future transactions. You can have the cards on file, and it makes it super easy for somebody to just click, click, and they're done in a few clicks to get through. You saw how easy it was to get through the first few forms. The longest form was typing in a credit card, and if you've got that already saved, it's an extra click.
Honestly, if it's Apple Pay or Google Pay, it's even easier to just double tap on your phone to finish that process.
100%. Yeah. We know people like that. We know people are using those wallets more. And so allowing for the easiest way to complete payments is super useful. And kind of as a summary here, just if it's connected to your EHR, if we can pull that information out and they've already got a profile, we can pre-fill that form. You saw how it was pre-filled for the demographics. We can save where the patient's at, makes it a lot easier. Also sending reminders if patients start and they don't finish. That's again, the beauty of this is making it convenient for patients to complete when it's makes sense for them. And then thinking about the other side of it, we've got Yelena here who's, watching, trying to figure out when Sophia's going to finish everything. She can send those automated reminders and she can see what's happening in real time as Sophia's going through the details. So here's a quick video of what it looks like from a staff side. So in this example, we've got Sophia. She's completing her checklist. She's part of the way through here. She already started her insurance, and then we see that it's now completed. We've got some information. We see what that eligibility looks like. There's an alert to warn staff that, hey, something might have changed. And then you can see as Sophia continues on, we'll see that the appointment copay here, that $29, we'll see that patient payment get updated. And what that means is now staff can watch literally in real time as patients are going through this, they can see what's happening and have a kind of an insider's view to what's happening, where the patients are at, what else do they need to remind people about, and then as they walk in, they can also say, hey, I see you started but didn't complete payments or whatever else.
Interesting. And real quickly, assume that I've already seen the provider before, right? So if I'm a staff member, like there might already be insurance for my,
Yep.
past visit, what would that experience be like in that situation? Is it mostly just syncing back what may already have been provided in the past, or is that going to be net new insurance requests going to patients all the time?
Yeah, I mean, it's similar to the demographics. If a patient already has insurance on file that we can pull, then it's really just a review. Has anything changed? If something has, patients can remove the old insurance, add a new one, and that's when you get those alerts to say, hey, something's changed. The staff can see that alert, know what's changed, see all that highlighted.
And just a quick thing before we continue on, Caitlin, Valerie, I see you guys have some pretty good questions coming through. Justin and I would be more than happy to answer them. But the Q&A box is a lot easier for us to moderate while we're speaking in the Zoom tab at the bottom. And that will make it a lot easier for us to be able to address those without forgetting in case there's more that are being added. All right, Justin. We can
Awesome.
continue.
Awesome. Yeah. So as I highlighted, we've got the checklist view where staff can see that. You can also see all of the appointments in behind the scenes. I kind of very quickly clicked out and showed you that what it means to see all of the appointments. Yeah, see the statuses for them. So if you've got some confirmed, some unconfirmed, some arrived, you can see all of that detail on the schedule view and then dive in deeper to get that detail for a specific appointment.
Eligibility and payments. This one,
Yeah.
one.
I think the key thing that I'll highlight before we dive into this is that, as you think about eligibility and payments, those are generally considered a complicated area. And so we've spent a lot of time trying to make sure that we've got a staff experience and a patient experience that makes a lot of sense for both sides. And so as we dive into this, you can see Yelena here sees that Eliza's got a new insurance. We can get that copay. We can see what's going on there. We see all the details for that insurance. You can click in, make any updates if for some reason Sophia or Eliza in this case made a mistake. You can do all of that. And so another example is here's the patient side of the payments. We saw payments a little bit earlier. Want to highlight here that this is an example of what it looks like if it's just the copay that we're trying to collect. In the event where you want to also collect balance, there's options to say, I want to pay the copay, I want to pay some of the balance, or I want to pay the copay plus all of the balance. And so there's a lot of great options here to show exactly what you want to support in terms of pre-appointment collection. And then diving in deeper, all of that is visible to your staff. Ashley, in this case, is the great example. So she can see where the payments are at, what's happening from an insurance standpoint, all of the details of what the copay was, but also how much has been paid. You see in the bottom part of this screen, how much has been paid. Does Justin, in this case, have a prior balance? If so, how much would have been paid of that balance? So this allows for you and your staff to see all of that detail in a place as they're going through the schedule, make sure they've got everything ready to go.
Well, Justin, before we actually continue, I had a question around setting rules up for the staff to make sure that they're able to follow their business processes. Because I know quite a few of our customers sometimes may not want to be able to see patients if they have an outstanding debt or their balance might be higher than a certain amount. Or conversely, if their insurance isn't accepted, then there might be a separate form to send around the slider fee that can be able to get their information on willingness to pay. Curious as to whether that's actually a part of the current process with checklists and to be able to build in staff rules around how a patient provides information.
Sorry, Umair. I'm not sure I fully understood the question there.
Well, would I be allowed to see, like, if I was not allowed to see a provider at a business because I had an outstanding debt,
Oh yeah.
would that be something that would be alerted to staff if I was trying to kind of schedule an appointment and try to go through this process?
Yeah, I mean, there's probably also alerts in your EHR as well. But if you've got rules around not wanting appointments based off of previous balances, um, that's that is kind of a complicated thing, but it's something that we can work to support. Collecting balances is kind of day one. Having rules around based off of how much or how little. The other thing is like if you've got bad debt, where does that live? those are all kind of very specific business nuances. And so I think, as somebody wants to have those business rules exist, we can support those in the right way that makes sense, but also supports your goals from a patient experience and a staff experience. The real thing to keep in mind from a lot of perspectives here is our goal here is to support y'all in having that great patient experience. And in some cases, having a great patient experience also means that you think about, what does that collection process look like? Is it something that's going to make a patient vote with their feet and go somewhere else because I've got a collection experience that doesn't make me as an organization look great? And so those are the other things. As we continue to work with our customers, we want to make sure that we're helping them succeed in their goals of either growth or maintenance or whatever they want in terms of patient panels, that's the size there, and all those things that support their goals.
And on to
Any
the journey.
Yeah, I think, and I'm just gonna show one thing. Just one second. Let me stop my screen share for a minute because I want to show this video. Um,
Curious what this is going to be.
uh, so this video that I'm going to highlight, and I apologize to stop the screen share. I just wanted to make sure it was working. And for some reason, I'm having a technical issue. So 1 minute, I apologize.
And is this mostly around the patient experience being at the heart of kind of being able to achieve
Yeah,
these outcomes?
yeah, this is a little bit at the patient experience being at the heart of it, but also thinking about, like, what does that holistic journey look like for staff? So for staff and for patients. So let me share my screen here. Just 1 second now that I've got it working. Can y'all see that? There we go. And so this is showing kind of both sides of the experience here. What does that look like for the staff view? So on the left-hand side here, what we've got is the staff experience. And on the right-hand side, we've got the patient experience. So what does that look like as we're going through things together? As I highlighted earlier, we've got the schedule view here showing all of the appointments that you've got for a day. Given that this was in a demo environment, I expect that most people will have a much more full schedule than what we're showing here. But as I highlighted, we've got the complete patient, we've got another patient who's partially done. And then the example here that we're going through is what does it look like for Sophia as we're going through this experience? And here it really highlights a lot of, like I've said, you've got the 5 pillars. We see where things are going to get updated as we go through this. And then down lower, we'll also see what happens around the appointment copay as Sophia is going through this, what gets updated. We'll see the insurance update. Sophia doesn't have an insurance on file, but if she did, kind of to my earlier point, where if she did have that insurance on file, then we pre-populate that for Sophia. And
I see.
so now on the right-hand side, we've got Sophia going through. Any questions before I dive deeper on this?
No, so essentially you're basically able to surface all the information to staff, right? So as a result, they're able to actually see all information rather than having the patient have to experience that on their end through
Yeah, 100%. It means that, staff, you don't have to have your staff, hey, did you complete this? Oh, yes, I did. You can see it. You can see what's happening. You can track it in real time if you've got a patient sitting in the waiting room who didn't finish everything and you said, hey, I really would love for you to complete these couple items. You can see where they're at in completing those items as it's going through. And so on the right-hand side, you see Sophia, she's got her checklist. She continues to go through, and as I said, it updates in real time. So immediately as she goes into that first form, we see on the left-hand side that it gets updated, that it's now incomplete. That basically means it started but not finished.
I
So
see.
as she continues forward, we'll see that Sophia updates on the right-hand side. She's now on to her next step. And for the staff, it does take a couple seconds to update, but we'll see that update right now. Um, and so again, this is a very simple clinical intake form here. The beauty of the forms configurability that we've got here is that if you've got a more complicated clinical intake, or if you've got clinical intakes that you need to configure based off of specific uh, specialties or appointment types, different doctors, those clinical intake forms can be customized to your needs. And similarly, demographics, consent, and legal, those are all able to be customized. And the beauty there is if we've got that field that we can write back, it can also be posted back into the EHR. Not every clinical intake question is easy to write back based off of fields and EHRs and all the fun nuance there. And then here we're showing how it looks in terms of signing it. I didn't have a real phone in this example, so just typed it in, but that's what it looks like for consent and legal. It's pretty simple, probably comparable to what most people are seeing for other consent and legal scenarios.
I'm curious to hear like so where would screeners like a PHQ-9 fall? Like would you be able to send those as well as part of the checklist?
Yeah, so most screeners I would kind of think about in the clinical intake category. There's a lot of great opportunity there in terms of having logic based off of what you need to have happen with that screener. So if you've got a screener questionnaire that how somebody answers that one question needs to decide how they get to the next 3 or 5 questions. There's opportunities there to have what we call jump logic and kind of guide folks to the right places based off of that.
Awesome. Well, thank you. This really helps understand both together. Right, how the staff experience and the patient experience are very connected in how this workflow comes together to drive those results for the system.
Yeah. And as we're now getting into like the more complicated stuff, the insurance and the payment, shouldn't say more complicated. It's all really interesting to think about, but there's a little bit more nuance around what we have to think about when we think about these. So on the right hand side, we've got Sophia. Like I said, she's adding her insurance here. She picks what her relationship is to the subscriber. She types in her member ID, and then she can also add an image for the card. I'll highlight it in a little bit. There's also opportunities for the experience here to improve, to support Sophia and other patients in a better way to make it easier for patients to see what's going on. And then as I highlighted earlier, you immediately get those updates of Sophia's now got an insurance on file. We see that alert is added for staff in real time, like very quickly you can know. And if you click out and you see the schedule view, you can know which patients have those alerts because they've got that yellow highlight. On the right-hand side, we see Sophia clicking forward. We see the eligible response. We also see that that's going to get updated here in the next couple seconds. And it's also going to show the copay based off of what that response came back. And so that all gets updated. Again, in real time as things are happening, we see Sophia have that highlight. Now, when we go back, if we dismiss that, she no longer has that highlighted to say, hey, here's what's going on. Here's the next piece of information that you need to see. And so as Sophia continues on, we've got that great experience where she goes to her next item. We're clicking on that. We see the payments. Again, this is the payment form that we've seen before. And to your point earlier, you've got that save for future transactions. We also have that configuration or that option down at the bottom to pay later if you want to support options for patients to pay at the time of service, rather than paying before they walk in the door.
Awesome. And I'm curious, what if a patient doesn't get a chance to complete these before they show up to the front desk? Is it still possible for them to be able to kind of check in for their appointment?
Yeah, there's definitely ways to do it. So I'm going to pause here now that we're at the end of the experience, the full journey here. But to answer your question, yes, there's ways to do it. There's a couple ways. One is you see this resend checklist button right here on the video. you click on that, that sends another text. The patient, if they've got their smartphone with them, can just sit down and finish whatever else is remaining. They get that same view of the checklist. They see what they might have started, what they might have not started, and then they can, sit down in the waiting room, finish it. We also have a couple other options around completing things in the office for folks that don't have their smartphone with them. Um, and like handing a tablet over, handing a tablet that allows for the patient to complete that, even if they don't have a smartphone, and then it's still in a digital format so that we can continue with that right back, so that you don't have to have papers scanned in that are a little bit more complicated, and some copy and paste or manual typing to make staff
Well, I
harder.
feel like you're almost setting us up for a surprise later on in this webinar, Justin. I'm excited to see what's next for readiness too.
Yeah. Any other questions on the journey, Umair, before we dive into some of this other stuff?
No, I feel like we're gonna be able to get to what's coming next before we get to the questions that our
Yeah,
audience has.
awesome. So, like I just highlighted, we do have coming soon in terms of supporting the what we call readiness for kiosk and readiness for tablet. Really, and the tablet experience is allowing for a lot of great experiences around passing that tablet off, or even supporting scenarios where you might have a mobile clinic and you need to have staff have a tablet they can pass that over to somebody when they're talking to them in a non-office based environment. So think, mobile clinics that are buses, mobile clinics where people are walking the streets and talking with folks. Having a tablet experience to complete these forms is super great. And then from a kiosk standpoint, allowing for that check-in to happen, but also if there's remaining items, complete that and collect payment at the kiosk as well.
That's really exciting. And so just quickly about this, real quick. I myself have had to, I've used the clinic app that we're kind of developing with the readiness a team. And one of the most useful use cases, Justin, that I found was for in New York where I'm based, there's the New York education form that requires my provider to sign it in front of me. And I find it really interesting that I could use actually our tablet to be able to kind of turn it around, have them sign the exact document that the New York State requires, and then
Yeah.
have it back to me to sign, and it still goes into their EHR the same way. So I know that this is going to be a really exciting one, not just for the kiosk workflows, but also for some more applications within the care delivery continuum.
Yeah. 100%. There's a lot of beautiful things here to help folks have those better experiences for patients. Like you said, that's a great scenario for the readiness for tablet or clinic app approach that we've been working on that supports those scenarios. Because if you have to sign a physical paper and have two people signing that physical paper, it sometimes is the paper might get lost in the mail, in the drive home, whatever else. So yeah,
That's what always happens with me, which is why I was like, let me just try to take this with me, actually, for a change. And I think we're looking at a delivery of around early next year, for the kiosk, because I know this is a question that just came through, but I
yeah,
just wanted to address that right here. We're looking at early next year for both the kiosk, as well as the tablet view.
yeah, 100%. Yeah, there's active work happening to make sure that we can support folks for these use cases because we know that they're important. We've had folks ask for both different use cases, and I will say this, if you're interested in them, have a conversation with either your Luma CSM, customer success manager, or whoever you're talking to at Luma, and that will help me look for those opportunities to support you and your staff. I think the other key thing to keep in mind is that like I view these as very unique use cases. Kiosk is different than a tablet use case. The tablet use case meaning you have somebody who's physically handing it over. You're interacting versus a kiosk where it's a little less hands-on for staff.
So thank you for that. And what else do we have cooking?
Yeah. So as I mentioned, when we talked about the insurance, we recognize that having patients type in those details manually is not the easiest experience for patients. So we're also working on ways to leverage AI, leverage Spark, our specific AI, to be able to upload that card and have those fields automatically populated for patients. Um, a great example that I often use is, I've got an old insurance ID card that has a member ID, and then for each person, it's got a suffix that if you don't include that suffix when you do an eligibility check, then it will always fail. Most patients don't realize that that's a thing that they need to remember to put in when they're typing in the member IDs. And so leveraging AI, we can say, great, like we know that we need the member ID. And in cases like this, we also need the suffix. We can pre-populate that. Patients can be like, yeah, this looks right. You added something that I wouldn't even have thought of adding. And then they move forward and the eligibility actually will work rather than having a failure. So super exciting, also coming soon kind of thing. This is our coming soon area. So this is active work happening to make sure that we can support a better experience there for patients and for staff. So you don't have to fix something that a patient might have fat fingered or whatever else. And then you can move forward, have that eligibility confirmation happen. It's a lot easier experience.
All right, so I want to make sure that we can kind of get people started on getting these readiness products in your hand. So if any of our customers are already using Luma Forms, you have the ability to kind of switch to the new checklist view as well as the new schedule view that you saw Justin sharing right now as of today. So if you're interested in this as well as other products, please do contact your customer success manager and they'll be able to kind of facilitate that. Like I said, we actually have bi-directional forms, the checklist view, the schedule view, insurance eligibility, including the calculations, as well as patient payments available today. So everything that you've seen that wasn't in the coming soon section is actually already in Luma and ready to go. And of course, you will have you have the product team here as well as the awesome teams like Luma that are there to set you up on a guided implementation. If you are new to Luma, we have a very solid process of making sure that we understand your business needs. And as Justin also really, reiterated, can advocate for both your patient experience as well as your staff experience to help you get your system needs. So please do reach out if there's any people who want to move forward with this. But I do want to now open it up for the questions. I know that people have been kind of burning to ask a few things here. Justin, I'm gonna try to see if we can back and forth this a bit. I know that one of the questions that we've gotten is this is what of these components are actually directly connected to the EHRs? And if so, like which ones actually are we working with?
Yeah. So we call it the bidirectional write back. And there's a lot of components here without getting into the specifics of each EHR, which if you have questions about your specific EHR, feel free to reach out to your Luma team. We can help you figure out what actually works. But demographics is pretty consistently available. Clinical intake information, consent and legal. There's some nuance around what we can write back with consent and legal based off of each EHR, but those are kind of the three areas as well. And then payments, there's work. We've got some EHRs that are working. There's also other EHRs that we're actively working on to be able to pull what's owed and then also post back against that. So early EHRs that we've got that are successfully pulling and posting are ECW and Cerner. We're actively working on other EHRs like Meditech, Athena Health, all of those ones. So if you've got more questions, please reach out. I can help navigate the specific nuance for each EHR, but there's some very customized things there. And then in terms of insurance right back, there's also some nuance there in terms of what's capable to be written back. Not every EHR has a great spot for us to put things like eligibility results, or if somebody's eligible or ineligible in a way that is accessible to us from an API standpoint. So those are also nuances as well.
Great. And then I had a question from Melissa where when the patient actually completes a new patient paperwork form? Does it actually override and correct what has already been placed in the EMR? I think this one's actually something I can take, Justin, as having worked on a lot of these bidirectional forms myself. So for new patient paperwork, we're hopefully creating a new patient normally in your system, but generally when it comes to bidirectional form write back, while there are a lot of fields that we will just directly write back and update in the EHR, there's also the reconciliation process that we normally recommend for some of the more crucial fields for delivering care. Because this comes into the whole, like, sometimes I mess up when I'm typing things in a form digitally, or, sometimes I'll leave them blank on a paper form. So it's always best if you already have good data hygiene from a patient before to trigger that reconciliation process in the EHR. And each EHR is slightly different as to how they facilitate that. Some of them have like a pretty easy alert system. And then, of course, we can configure that with you, but our recommendation normally is for the critical fields that are actually crucial for your reporting as well as for your ability to actually get the right information from patients, to rely on the reconciliation process. It's a lot easier than having to type it in as a staff member, regardless.
Yeah. I think one thing also to add there, Humair, just because I like I said, I think about this a lot from a patient experience standpoint as well. In some cases, there are also things that you want to write back, but you want to be careful how it's written back, and also what you're requiring patients to actually fill out. A great example is medications. Most EHRs have, 5 or 6 drop downs with like 30 or 40 options for medications. If you expose, PID to most patients, or 5 times a day as is the frequency for a medication drop down, and it's got 40 other options, it's pretty difficult for most patients to understand which one they should pick. And so there's a lot of thought there in terms of how to support that in the best way, and then also support that reconciliation right back as well that makes the most sense to your EHR.
And just as someone who's worked with data before as well, it saves a lot of time when things are done automatically, but when things are done automatically in a way that creates more work, it can also be the worst possible situation to be in. So again, that's where our implementation teams and kind of our customer success teams are experts at being able to guide you to the best practices, as we've seen around more than 600 customers across the nation to engage your patients. I see another question from uh actually, this one is from Caitlin. The demo that you showed them, Justin, it showed that the patient was allowed to continue without adding the address field in the form. Is it possible to make certain fields required, or to make sure that the patient fills them out before it's approved?
100%. That's the beauty of the configuration options that we've got is, you can have any field be required. You can have questions, the way I showed the demographic questions, that's a question group. So you could have all those questions on one page. You could also have those as individual pages if you prefer that. And so just thinking about what that patient experience is like is super important as you go through this, because you might say, yeah, I want the address field required. And that's totally fine. What we're using there is we leverage a lot of the Google Maps API to find addresses that are accurate addresses. So you're not putting garbage in where somebody types 123, Main Street, and they type an extra N in at the end of it or something weird. That's not actually a real address. So leveraging all those different capabilities that we've got, you can have required fields, uh, you can have different things right back. You can leverage drop downs the way that makes the most sense for you, as well as if you have 5 questions on a page that you want to throw on there from a radio button standpoint, we can also support that as well. So it's a lot of configurability options.
Awesome. Thank you, Justin. And then Carmen actually asked, could you load your own consent and policy forms in there? And I'm happy to take this one, because as I was just chatting about kind of what I did with my provider here in New York, you can actually work to be able to load like a custom PDF forms for consent and policy using our partnerships with DocuSign and as well as other third-party agents that allow us to take these sometimes structured forms. So in my example, for some reason, New York State requires that form to be in that exact same PDF format. And so it can't be any of the digital formats that, some of these new tools provide. And as a result, we actually leverage our partnership there to be able to bring custom consent and policy forms in. And I see another one is rather similar. It's like, will Luma, Justin, and this one's coming as a question that we've seen a few times. Will Luma be able to obtain benefits as part of the eligibility process? And so if so, can it message the patient prior to the appointment with information to collect that copay or deductible?
Yeah. So I assume when the question here is asking about benefits, they're talking about the full plan design. All of the different deductibles, co-insurance, what are the amounts, how much have they met? What we're doing behind the scenes for those who understand more technical nuances here is we're doing a 270, 271 transaction. That means we're going and asking the insurance company for the details. We get all of those details. We have a way we're displaying that inside of the Luma experience for staff to look at if wanted. But right now the focus is on getting that copay out in a way that's because that's a structured way to do it in order to get like better estimates and be able to collect based off of where somebody's at in their deductible. There are some steps that we're taking actively to say we also need to pull in stuff like your charge master, how much you're charging per code, what you would expect certain appointment codes to be like, so you can get better estimates. And those details will allow for us to provide better estimations for patients, but it does require some extra information to be pulled from you in terms of a customer where you're storing that information. Let's say, you generally estimate office visits around $115, and so you want to collect $115 from folks who are on high deductibles. That's you can do that today. You can set it as a custom value. We can send specific payment requests, but the estimation part of it, taking that from the 271 result and actually saying, hey, we expect this appointment to be $115. That's the extra step that we need to do, and that technically doesn't work today, but there's active work there to support that.
Thank you. And then just as a follow-up to the same we have thought, what if a patient wanted to add a new insurance? Because I know Jess had this question when they may already have an existing one in. Is that possible? And how does that work?
Yeah, it is possible. I'm trying to think of the best way. Like I could show it to you. The way to add a new insurance is when they get to that insurance question, if they've got an insurance on file, it'll show and present that insurance as it is. But there's also a button that says edit, similar to what you've probably seen on most web applications today. You edit, you can remove old insurances, with a little toggle there to delete it. And then you can add the new ones. There's buttons to add new insurance as well. So there's lots of options. If you've got patients who have multiple insurances, they can add the multiple insurances. If you've got patients who need, it's a new plan year, their employer switched insurance companies, that's also an easy thing to do. And then we've got, confirmations if you want it configured, we can also check and prompt patients to be like, hey, are you sure you added all the insurances? It looks like you haven't updated it. Do you have any that you need to delete? If you add a new insurance, we'll prompt patient to be like, hey, you didn't touch these ones. Are you sure you don't want to touch these ones?
Well, thank you, Justin. Those are quite a few insurance questions, and that's all, like you said, it's a bit of a complex problem to begin with. I think the last question that we should be able to take would be by Deanna about if the completion doesn't get done in Luma, whether phone or tablet, can it be completed in the EHR? I can take this one. I think, Deanna, that really depends on your EHR. I think that's something that I'm sure that's possible with like certain EHRs in their configuration. So if you can already do that with your EHR at the current moment, then that will be a backup available to you should these approaches not be something a patient is willing to go through. So hopefully that helps answer this question. But again, without knowing the exact EHR and like how your setup works, it's a bit tricky to answer that one. But we've seen most people be able to do it in Luma perfectly fine as well. So as long as both options can handle that use case, you can actually use both in tandem without any issues. The EHR will, as our philosophy says, will always be the source of truth, though. So that's where like the information that is actually what we consider to be your practice's source of truth would live. So, well, thank you, Justin, for spending time with me, and letting me kind of ask questions as well as letting our staff experience and patient experience shine. I know this has been a labor of love for the Luma teams to get right, and to be able to bring into the patient experience. And I hope everybody who's joined us today will be able to try it out. So do reach out to your customer success teams, and I do hope you have a really good weekend coming up.
Yeah, thank you, everyone. Appreciate your time. I know there was a lot here, so if you have more questions, please feel free to reach out to your CSM folks, and they'll get them to me. They know how to get a hold of me.
Or info at Luma Health if you just want to reach out to us in general, and you can find Justin or I to chat deeper about certain use cases too. Thank you, everyone. Have a great weekend.